Good evening, everyone. Welcome to the latest long-term care family update with Grey County. Tonight, we have Jennifer Cornell, Director of Long-Term Care with Grey County on the line. She will be providing an update about what we've been up to, how the homes are doing, and followed by a long Q&A session. We have time until about 8 o'clock or until we do run out of questions this evening. I would ask that you type your questions that you have in the Q&A feature on your screen. This only applies to our people joining us online. Unfortunately, we won't be able to take any calls live from those of you calling in on the phone. But if you have any questions that we aren't able to answer tonight, you can certainly send them by email to communications@grey.ca, and we will get back to you as soon as we can. So with that, I will pass it over to Jennifer.
Great, thanks, Rob. Good evening, everyone. It's a beautiful evening out, and so I have the screen door open, and if it gets really noisy, I'll have to jump up and close that. So I do have an update that I'm going to go through, and as I have in the past, I'm going to read through it, and then we can open it up and do some questions. So I'll start with the piece that our legal team encourages us to do. So this presentation is intended for the family and loved ones of the residents of Grey County long-term care homes. We encourage you to share this with others in our community. For those viewing this who have family or loved ones in other long-term care homes, please understand that this information is only related to the Grey County homes. Please contact the home where your family member or loved one lives if you have any questions about their care. So as Rob said, thanks. County's 3 long-term care homes, Lee Manor in Owen Sound, Rockwood Terrace in Durham, and Grey Gables in Markdale. And welcome all, and thank you for being here. So we met last virtually on May 1st, 2020, and I could hardly believe that it has been that many days. Since we met virtually, though, we have also provided some written updates via the MailChimp each week. And if that is not familiar to you, send us an email and we'd be happy to get you set up with that. So in that time, there have been further directive updates from the province, the Ministry of Long-Term Care and Public Health. Infection control, staffing, and PPE strategies continue in the homes. And as of today, there continues to be no positive cases of COVID-19 in any of the 3 homes, or Grey County, broader Grey County as well. The purpose of our call tonight is to provide an update and to reassure you that we are doing everything that we can to keep your loved ones safe while continuing to color it for them every day. During this call, I'll provide an update on the testing results, the military report on long-term care of 5 homes in Ontario, provide an update on window visits and essential visiting, discuss staffing levels, a few follow-up items from the last call, and share some information around planning for gradual reintroduction of services. So we have been actively working on all things COVID for many, many weeks, and we are committed to staying the course. The week of May 11th, all 3 homes had universal testing completed. That was 717 swabs of testing for COVID-19. All results came back negative with 1 false positive at Grey Gables. I'd like to commend all the team members in all 3 homes for pulling off this feat. A lot of coordination, partnership, and planning went into this initiative. I'd also like to thank all of the team members and residents for their willingness to be tested. It is a test that nurses describe as causing some discomfort, but I've heard some more detailed descriptions of the experience, and so I'd just like to say thank you for all participating in that. I would like to remind everyone that the universal testing was a point-in-time prevalence study. It was very reassuring to know for certain that no one in the homes had COVID. It unfortunately does not change the fact that there continues to be community spread of the virus, and we must remain vigilant in our strategies to prevent infection. On Tuesday, A report was released by the Canadian Armed Forces about 5 long-term care homes in Ontario. I was asked to make comment for local media, and I'll share with you this evening our key messages about that report. So the military report and the issues found in it are very troubling. No one deserves to live in conditions like those, and our thoughts go out to the residents and the families involved and affected. The report highlights homes at their very worst and at their very most desperate, but it does not reflect all long-term care homes. At Grey County's homes, we continue to work tirelessly to ensure our residents have access to the highest level of care possible as we navigate our way through this ongoing pandemic. Our homes are stable and we currently have no outbreaks. We are very, very proud of our Grey County long-term care staff. We select them carefully, and they all participate in an extensive annual training program. We are extremely thankful for their continued dedication and hard work under these very challenging circumstances. And lastly, homes across Grey Bruce counties are in regular contact with each other. We share information, we share best practices, and we work together to solve challenges and problems. We're here to support each other and the people in our care. In fact, the 19 Grey and Bruce long-term care homes, we have a weekly meeting, a Zoom meeting like this. And so there's representatives from all 19 homes, as well as the public health outbreak team that we work with, representatives from the hospital and the crisis response team. And we meet weekly and work our way through the strategies and challenges that have come with this pandemic. And it's through these partnerships and collaboration that we can work towards an improved system with resident-centered care as a priority. In Grey County long-term care, our promise to color it your way keeps residents at the center of all of our decisions and planning. Throughout the pandemic, we have prioritized the health, safety, and wellness of the residents, the staff, and the community as the foundation of every decision. And I actually have a sticky note on my computer that says that, because I think it's important. And when we have a tough decision, it's important to go back to what's our foundation for our decision making. So I'd like to quickly go over the strategies that continue to be in place. Staff are working in one facility only. We're minimizing the movement of staff from home area to home area within the home. All staff in the home are wearing surgical masks at all times. All new residents moving into the homes from the community will be tested for COVID, will receive a negative test, and will be isolated for 14 days when they move in. Hospital admissions continue to be paused for right now. The leadership teams in the home continue to have a revised schedule to make sure they're providing support and leadership 7 days a week. Plans are in place in all 3 homes to quickly isolate residents if needed. Plans are in place in each home to quickly move into full outbreak protocol if needed. And we continue to monitor our PPE supply and report our inventory to the province daily. We have just received an order of enough surgical masks to support universal masking for staff across all 3 homes until August. I have made a commitment to discuss and reevaluate the visitor restrictions that are in place every week. We do that. While we continue to focus on keeping the virus out of the home, we work closely with public health and our clinical teams on evaluating the risk of various activities. The window visits are going very well in each home. The teams asked me to pass on their thanks to all of you for your patience and understanding as we all work through these changes and initiatives. Directive number 3 from the Provincial Medical Officer of Health is still in place and still restricts all visits with the exception of visitors for residents who are palliative. I'm part of a regional long-term care planning table for the Southwest region, and we have advocated to Ontario Health West for clarity and revision to the directive number 3 to allow us to expand the definition of an essential visitor beyond that for palliative care. While that work is happening, we are actively preparing strategies to safely support visiting. This will open up gradually and with great care. I know what an important and necessary step this is, and I will keep you informed. In the meantime, We remain committed to assisting with virtual visits through the Color It Connect program and window visits. Staffing levels in the homes remain stable, and I try not to miss an opportunity to give a shout out to our dedicated and caring staff who are working tirelessly to provide Color It Care and service. The homes have also recruited or are recruiting emergency support workers. This is a temporary position that the person will be trained on site to provide support within the home. These new staff will be helping with non-direct care activities like helping with dining service, making beds, additional cleaning, screening at the doors, those types of supportive care that really make a difference. A few items of follow-up from our last call. Foot care. Foot care is happening in-house. Foot care kits have been ordered and received, and registered staff have been scheduled additional hours to complete foot care on residents who used to be seen by our contract foot care provider. Just this week, that need to be in place to safely bring back our foot care providers into the home. This will not be today or tomorrow, but it is a good sign that planning is underway. Hair care. This is something we all are desperately waiting to come back. What we know for now is that hair care is going to be permitted in a later phase of reopening. That's the information I have from public health right now. In each home, though, there are creative strategies to support residents in needs, and there's unique strategies happening at each home. Each home is fortunate to have either program staff or other team members who have some skills, and they're sharing those skills with the residents. There has been a lot of discussion and media coverage on the phased-in reopening of many things in our community. We're not quite at that stage in long-term care, but we are busy planning. We're planning for a gradual reintroduction of services. We're working on a phased-in approach in a similar way to the community, and we're looking at all of the services and programs that were affected by COVID, and how do we phase those back into some sort of new normal. Some of the things that have started in the home already are small groups of less than 4 residents from the same home area, and those are a small group activity, physical distancing measures in place with 1 staff member, 3 or 4 residents from the same home area. We know how important it is for residents to be seeing someone other than their roommate, if they have one, their PSW, and the staff that are coming and going. So we're already introducing that back into the homes. Residents are very much enjoying the nice weather that we've been having and outdoor spaces, lots of outdoor walks and time in the gardens. We are continuing with virtual visits from our PT and support to do one-on-one exercise programs in residents' rooms, and we're just making the discussions and the plans to move forward to small group exercise classes, and so we're looking at what that looks like. So lots of planning, lots of to see where we're at and what the next steps are, and that sums up the update, and I am happy to answer any questions. And I apologize because I think I can hear dishes crashing. I don't know if you can hear that, but that's the sound of an 11-year-old doing the dishes, which is what we wanted to happen. So
I'm not hearing dishes in the background. We are having a little bit, I think, of lag on the video end, Jen, but we can hear you pretty well. So I think that's all right. So our first question tonight was about foot care. And I think you did talk to that a bit. So I will just go on. So we have our next question here is congratulations on testing results. Congratulations on testing results. I truly appreciate all staff do for our loved one. However, some loved ones are not understanding the long isolation and no visitors. Will there be a change in the visiting for the elderly, one person such as a spouse, to be chosen by the client to be allowed to visit?
Yes. So I'm wondering if I should turn my video off
That might help
and
a little.
see if that helps with the. Okay. So does that help? Can you hear me now?
Yep.
Okay. I'll turn it back on. I'll try it again in a minute. So thank you for that question. And we appreciate the challenge of isolation and the impacts that it has on all of us, and in particularly the impacts that it has on the elderly and residents with dementia and other other challenges, hard of hearing, challenges with vision, and we appreciate that the virtual visits don't always fit the bill. So I am on a regional committee subcommittee that is looking specifically at guidelines to support long-term care homes in broadening the definition of essential visitor and what those guidelines might look like. So there's drafts happening. The recommendations from this group are going to the leader of Ontario Health, West, who has the opportunity to review it and influence decisions more broadly. And I was also wanted to mention, if this question had come up, that the Family Council of Ontario is an excellent resource, and they are also actively advocating for a measured approach, a safe measured approach to allowing visitors. And they just sent out an update today. They're at the provincial table advocating and giving advice, and I think that's great. So I'm very hopeful that it's coming, and we're actively working in the homes so that we're ready when we get the nod to communicate and get those visits started. And as I said, it will not be a fast open the gates process, but it will be a measured approach, and I'll keep you well informed.
That's great. So you mentioned earlier in the call that we tested all staff and all residents. Did we communicated the results with all residents to let them know about the testing?
Yes, we did. And there's been lots of communication with the residents. A lot of the residents know the scoop, and they know what's going on. They sometimes hear the news before we do because they're tuned in to the media coverage, and so they are up on that, and they've got lots of questions. The Ontario Association of Residents Council has also provided us with a toolkit, all long-term care homes, with a toolkit for communicating with residents, and it's a checklist to help us make sure that we're not missing some of those key points in keeping the residents informed.
Great. So we have a question asking if families could have regular updates from the staff directly involved with their loved ones and how the family is coping, whether that be by phone or email. Is that something that's possible?
Yeah, I think that's something that we can figure out. In the meantime, so there's a couple of available programs through Point Click Care, which is a system that we work with to support our documentation. And there is a part of that program that allows us to give updates directly to the person indicated in the file as the person that gets the updates. So so that is something that we just received it and are training on it and figuring out how it works. And so that's something we're working on. In the meantime, though, if you have concerns or questions, or not even concerns, you just like an update, I encourage you to reach out to the home. There's email addresses on the website of how to contact folks. The phone numbers are there as well. or send me an email, and I'll get you connected to the right person. But reach out, and we'd be happy to give an update.
Thank you. We have a question about the thirsty plants. Are they being watered on behalf of residents?
That's a great question. I don't actually know the answer, but I'm confident that the plants are being watered. I will follow up though, and make sure that abandoning any plants.
Jen, can you speak to the staff to resident ratio? Is that consistent from our homes? Does it vary a little bit?
Well, and that's information that at one time I did have on the tip of my tongue. I don't have those specific numbers right off the top of my head. What I can say is that the staffing levels are stable. We are recruiting the emergency support workers to support the times when we are short-staffed, if we aren't able to fill a shift. And we have increased the hours across all departments to support all of the activities happening because of the pandemic. So there's actually additional staffing hours in place now than there was prior to the pandemic.
Does that include the redeployed staff that are helping out as well, Jen?
Yeah, that we have done those things, and there's redeployed staff also providing support in the homes.
Excellent. I'll take this one, Jen. Jane is asking if we could have more notice for meetings. And I will be honest with everyone. Our intention was to originally to host this meeting last night. However, mid-afternoon yesterday, we discovered that the invitation was still sitting in draft form in our outbox. So we wanted to make sure that we got it in before the busy weekend. So I do apologize. We're going to aim for a lot more notice in advance of meetings in the future. Jen, has there been any talk about setting up support groups for family members at this time? As hard as it is for residents, I'm sure it's very hard for the family members as well outside of the home.
Yeah, that's a great question. And I will look at information and circulate it out to the group through MailChimp. There is some opportunities with some partnerships that we've made with the Alzheimer Society of Grey Bruce, and they offer some really great programs to support caregivers. And it doesn't have to be only for caregivers who have a resident with dementia or Alzheimer's. They've adapted their programs to be able to support all caregivers who are struggling or just want to talk to other caregivers. So I will touch base with Stephen at the Alzheimer Society, and I will get that information circulated.
That sounds fantastic. And I will put in a plug for the Alzheimer Society. This Sunday is the Walk for Alzheimer's. It's obviously a little bit different this year. People are walking from home to raise funds for local supports and programs. So if anyone on the call is interested in learning more about that, you can visit the Alzheimer Society website. All money donated locally stays locally to support our programs and our neighbors and our families. So Kathy is asking, so as you said, our last round of testing was a snapshot in time. Are there any plans for future rounds of testing in a couple of weeks or another point down the road?
So far, we have not heard that. The is now focusing on other congregate settings and enhancing their testing capacity more broadly than long-term care and individuals with symptoms. So we haven't heard that there's going to be another round in a few weeks. What I can say though is that we continue with our active surveillance of residents and staff, active screening twice a day, and if anyone has any symptom, even one of the laundry list of symptoms, which is a very long list of symptoms, whether it's a typical symptom or an atypical symptom, that person is, if they're a staff, off they go to an assessment center and they have their test done. And if they're a resident, then we do a test, send it away. If they don't live in a private room, we follow the outbreak protocols and we isolate that resident from their roommate, notify the family, and wait for the results to come back.
So we have a question about the outdoor time. Are all residents taken outdoors? How is it determined who gets to go out for walks and the frequency?
So the program team is doing their very best to be everywhere in the homes. And so they do have a system where they document and keep track of who they've got to do some programming and who maybe hasn't had some activities, one-to-one, some sort of socialization. And so they do their best to meet the needs of the residents. If somebody wants to go outside, they do their best to make that happen. I can't speak, I don't know what the frequency would be for each individual, but that's something that if you reach out for an update on your loved one, that's something that you could ask about and they'd be happy to go over that with you.
All right, thank you. Can a caregiver, not a power of attorney, get information on the health of a loved one?
So okay, it's a good question. The way the privacy laws are, we are able to give health information to the substitute decision maker. In some cases, the substitute decision maker has said, please give information when all these people call. But that is very dependent on each individual resident family situation. And that has to be taken into consideration. But legally, we give the information to the substitute decision maker or power of attorney.
Okay, thank you. We have a question about medications, and I think this would be related to the report earlier this week. Do we have systems in place to ensure that we're not giving any expired medications to our residents?
Yes, I'm going to say yes. Can I detail what those systems are? No, I cannot. But I can look into it. And I'm not a nurse, but we have very strong, knowledgeable, experienced clinical teams in all three homes, and we have specific policies and procedures around medications, and medication management is an entire program unto itself. And there's education that goes with it. We partner with our pharmacy provider. We have access to a pharmacist and a pharmacy team to provide us support when there's questions or concerns. So I'm confident in saying that we do have a system.
Great. So this question says, I've heard about restrictions on fans in the residence due to concerns about moving the virus around. After a very hot week, are we going to be able to provide a portable air conditioner unit to our loved one going forward?
Yes, I just saw an email go by and I'm wishing that I had read it and retained every detail of it at this point. But the gist of what I remember, so we've reached out to public health just to get confirmation on that, because we don't want to put anyone at risk because we want to bring in a fan. So the answer from health, it's really situational. So there is no COVID in our homes. So the risk of having a fan is very low, and the risk of being too hot is very high. So we balance those risks, and yes, as long as we don't have COVID in the home, we're not at an outbreak, public health supports us in allowing fans to keep the residents comfortable.
Very good. So I'm seeing a question in the chat here, a bit of a comment and a question. So essential visitors for spouses and how that might look like if each resident in the home has a visitor, will that increase the risk of exposure, especially when spouses will have to be driven to the facility by someone else? If all visitors are not self-isolating for 2 weeks, is that safe?
Those are really good questions, and really those are questions that we've been asking public health, working with our clinical teams, getting some feedback from our medical directors, public health, the directives. So we're working out, we're trying to sort out those details. So something that we might start with a phased approach is maybe we set up some system that has visiting happening outside with physical distance. So before visiting happens in the home, we expand the window visit to be in real life with no window in between visits, with guidelines and systems in place. And in the meantime, we're regularly working to ask those questions and get some answers. We're also using directives that have come out of British Columbia and Alberta, who are at a different phase in the pandemic than we are in Ontario. And so we're using those strategies that they have in place to help inform what we need to plan to be prepared for. And you're absolutely right that the balance of risk, what we need to do is balance the risk to the staff, to the residents, to the staff, and to the visitor, balancing that against the impact and challenges that we know come with socialization, social isolation, not seeing family, eating out your meals in your room, those types of things that we know that no one can sustain for months and months.
It's definitely a decision that is going to take a lot of thought, for sure. How long do staff spend with residents in a day, Jen?
So you've frozen.
Sorry.
Oh, there
Am I back yet?
You're back.
Okay, perfect. So do you know how long are our staff spending with residents each day? How much staff time?
I don't know. I don't know that I could put a number on it. So that is something that I can look at, see if I can quantify it. What I can say is the teams are really great to keep me feeling connected to the homes because because of the directives, I can't go to all 3 homes. So I start to feel a little disconnected. So the teams are great to send me pictures and videos and things that they have going on. And what I see is a lot of smiling faces. I just saw a video today that won't ruin it. It's a sneak. I got a sneak peek. It'll be coming out. And what I saw in those videos were residents and staff together. Staff, and the part that I really loved was the residents were smiling, and I could tell even with the mask on that the staff were smiling. So I feel that it's safe for me to say that there's a lot of interaction, and the staff take really seriously their role, not in this case, not only to look after the physical needs of the residents, but they've taken on that responsibility of being their person, touching base with them, making sure they're having some social connection.
I think it really ties into our Color It mantra, doesn't it?
Yeah.
If a person has dementia, how would they know to ask to go outside? This maybe ties into the programming staff tracking.
Yeah, so the programming staff do track and look into that, follow up on that. So residents are asking, great. If residents aren't asking because they have dementia and they're not able to ask, if it's a beautiful day and there's 3 or 4 people heading outside, I'm confident that people aren't being left behind. But if having said that, if you have worries about that, I really want you to give the home a call and just talk that out.
Great. Just some clarity. Are all 3 Grey County homes air conditioned?
I'm going to say yes. I need to check in on the details at Rockwood, but so I'm not confident in my answer about Rockwood. So I'm going to follow up on that, and I'll include that in a. Oh, someone in the chat box saved me, so thank you. Rockwood is good. Thank you.
Thank you. Kathy is wondering if a window visit could be done with an open window instead of a phone. In their experience, the phone didn't work well, and I would guess that there could be some challenges with a phone with hearing impairment. Is that right?
Yeah, I would say that that's accurate. So I haven't consulted with the teams on this, but I'm going to suggest that when you're making your appointment for the window visit, mention it, that that's something you'd like to do. And then I'm going to ask the teams to do that risk assessment. So is there a way of opening the window and making sure that you can still talk to each other, but are far enough apart that if anyone's speaking moistly or coughing or sneezing, that there's no chance of that infection spread. So I think there's ways that we can find a way to make that happen.
Great. So somebody's wondering what the attendance is of these meetings. So we currently have over 60 people on the line. We have had more than 100 at our very first one. As well, we do make these meetings available after the fact. We post the recording and send the link around, and those are viewed by quite a few families. I don't have those numbers directly in front of me, but certainly it's enough that we're finding that it's very worthwhile to continue to set these calls up and answer your questions. I'm not seeing.
I stopped. Sorry, I was just going to say I stopped looking at one when it was over 500 views because then I was starting to feel embarrassed.
And I think that one hit 1,000 actually, Jen.
Oh no.
Yeah.
That's good. I'm glad that people find them useful. That's the point.
Okay, so a comment here: the activation staff at Lee Manor went above all expectations in coloring it for my mom today on her 96th birthday. Staff was enabled mom to connect with family and friends across the country via video chat. That's awesome feedback. Thanks for sharing that.
That's the joy and happiness that we all need right now in this world, and particularly in long-term care. I know that the staff we're all in all the teams, all of us are feeling like that report was rough, and we want to make sure that we have that trust with our family members. We don't want to lose that trust. We know that we are taking care of people, the most important people. So thank you for sharing that.
Absolutely, yes, thank you. We have a question about organizing an open window visit before this weekend. Would it be best for them to maybe follow up with the home tomorrow directly, Jen? Will that give you time to reach out to the 3 homes in question?
Yep, I do know that a lot of the team members, some of the team members log on to the call because they want to be informed and they want to hear what is important to family members. But I'll face the team tomorrow. We were doing a daily check-in with all 3 teams, and in the last week we tried doing Monday, Wednesday, Friday check-in. So we'll be touching base together tomorrow, and we'll talk about that. But yes, each home has their own system for arranging the window visits. So touch base with the home.
Okay. So we do have a serious question here. When When staff see abuse in the home, who are they to report that to? Or I guess it says when one sees abuse, so maybe not even staff, maybe it's a family member.
Okay, so that's a really great question. And like the medication management program, there is an abuse prevention program within the organization that all three homes. It's something that staff are educated on when they are hired, and we do education every year about the abuse prevention program. It covers definitions of abuse and neglect. It covers how to report it, and the duty to report. Under the Long-Term Care Homes Act, uh, any one of us that works in a long-term care home or contracted or provides care service in a long-term care home, we have a duty to report any suspicion of abuse or neglect. So we go over that. We do it annually. And so if someone suspects or sees something that doesn't feel right, they are to report it to the charge nurse or the director of care or the executive director or another member of the leadership team or me. Uh, and we have an abuse prevention investigation checklist, and we immediately begin an investigation. We take every report seriously, and we work through the process of investigating.
And when those come in, Jen, do we maintain regular contact with the person that has made the claim, just to keep them informed of how it's proceeding?
We do. So we follow up with the person making the report. We also follow up with the resident and or their substitute if they have a power of attorney that's inactive. So we are regularly using the power of attorney substitute decision maker in decision making, or the resident says, please call and tell my person. So if the resident makes their own decisions, then the resident is who we work through the process with. Often it happens, the resident will say, please call my daughter, please call my son, please call my nephew, please call my person. So we do keep in touch with the power of attorney and from the beginning. And the legislation also requires that we do a follow-up and provide an overview of the outcome of the investigation as well.
Okay, thank you. So will there be rapid changes to the long-term care system Doug Ford and the announcements that have been happening? It's hard to stay on top of all of the announcements the way they're coming out this week, but is that something you can answer, Jen?
I don't know what I don't know how rapid. They've moved up. They've announced that they've moved up the commission looking into long-term care, and we fully support the commission. It's an excellent opportunity to be looking at a system that clearly is struggling, and everyone's doing their best, their very best. But there is absolutely opportunity to make improvements and changes. How rapid that will be, I can't say. I'm hopeful.
While you have your crystal ball out, do you think that there would be a chance of family members seeing their loved one in June? Or do you think that it could be longer? I know it's hard to answer, but with some of the protocols that we're working on now, can we say?
Sorry, Rob, you broke up at the beginning of the question.
Sure. So the question is there any chance of seeing our loved one in June?
Oh, I would love to say that I am very hopeful for that, but I don't want to make any promises. I'm advocating hard and working with a team to demonstrate that we have guidelines in place and guidelines that long-term care broadly can be aligned with. And part of that challenge is we want to make sure that we provide a toolkit for long-term care homes across the region that is realistic and useful to be able to support them in coming up with their own plan for visiting. And those are really key pieces that need to be in place. So I'm really hopeful, but I don't want to make any promises.
Feel free to jump in here if I'm wrong, Jen, but I think that this would probably be impacted a lot by public health, and that would be in a reflection of what our community numbers look like. We've been very fortunate in the last few weeks that our numbers are looking quite good, but we do know that there's the possibility of that changing as we're a couple of weeks out now from the long weekend and those activities and the reopening of businesses. So increases in numbers of COVID in the community could affect that as well.
Yeah, no, you're right about that. And public health is also really actively working on this. So there, if nothing else, I think we can be hopeful and heartened that there are lots of groups actively working on making some strategies that are safe to be able to expand the visiting. And that's public health, that's Family Council of Ontario and Ontario Association of Residents Council. That's the long-term care leaders in Grey Bruce. That's the more of the provincial teams. And if you check out Twitter, there's a hashtag, not just a visitor. And so there's caregiver support advocates who are also strongly advocating for a balanced, measured approach to this. So I feel that that's hopeful. A month ago, there was not a lot of listening available to that because we were still very much in making sure that everything was stable with our infection control strategies. We've demonstrated the stability, and so we're able to start looking at what's next.
Very good. I think you answered the question here about our duty to report in our protocol, so I don't think we need to go back to that. Are residents, when they're getting outside, are they doing any gardening while they have their outside time?
Oh, I don't know. Wait, I read something about gardening out in the gardens. I don't know if they actually have their feet in the gardens or their hands in the gardens, but I know they're out in the garden. I know I reached out to the resident family services managers just today to get some feedback on what kind of equipment, tools, supplies do they need in the homes to enhance these very small group activities in a home area. And I know one of the responses included raised garden, bed equipment and tools and supplies, and maybe shifting our dining rooms to be a multi-purpose space. So the large TV that you can do Zoom or bring travel things into the home. So there's a lot of creativity, a lot of innovation going on in the teams, thinking outside the box to try to bring the outside life safely into the residence space within the homes.
That's great. If you have any more questions, please type them in. We do have a few more minutes. I'm not seeing any new ones here, Jen. Are you seeing anything that we've missed?
Sorry, you were breaking up a little bit again. Since we've talked a lot about expanded visiting and safe visiting and what that looks like, I believe that my email contact information goes out with the video after the call. And I would really love and appreciate some feedback from you, the family members, about what's important to you when it comes to that expanded visiting or the reintroduction of services it doesn't even have to, anything that's important to you, I'd appreciate to hear. And specific around visiting, what's important to you? What are your worries? What is concerning? What you feel might be a barrier? That type of information, if you would send that to me, I feel that it's really important to have the family voice, the caregiver voice, as well as the resident voice and the home voice in the guiding principles that we're putting together for what our protocols are going to look like. So I'd ask, that's my ask of you, is to share some of that information.
Okay, perfect. Well, I'm not seeing any more questions here, Jen, so I think you've done a really good job tonight keeping everyone informed and where we're at. For those of you listening in on the phone, as I mentioned earlier, if you do have questions, please do email them to communications@gray.ca, and we'll make sure that we get back to you as soon as we can with an answer to those questions. And for anyone on here too, if you just weren't comfortable asking, or if something comes to you after the fact, you don't need to wait for these calls. You can contact us anytime, and we will get back to you. Jen, did you have anything else to add tonight before we?
Yeah, sure. Thanks so much, Rob. And again, thanks so much for being engaged in these calls. Thank you for your feedback. Always, I get a handful of emails following these calls that are so supportive, and it's that kind of support, kind, encouraging words that that bolster me and help me, and I make sure I pass those on to the teams. So we really appreciate that. We just can't say enough how supported we feel by you, the families, and the community. We are still in the middle of this marathon. I do feel like the route is becoming a little clearer each day, but we are very much still in the middle of the marathon. It's a marathon, not a sprint, but I'm confident that we will be able to get through it together. And again, thank you so much. I always like to thank you, the families, thank you to the staff, and thank you to the residents for your ongoing support, commitment, and courage. And have a great night.
All right. Thank you. Good night, everyone.